All right, let's talk about something every pre-hospital provider has to master: managing a patient's pain. Today, we're going to walk through the official pain management protocol, step by step, and turn this, kind of complex flowchart into a really clear, simple plan you can use out in the field. Okay, let's get into it.
So picture this. You're on scene and your patient is in a ton of pain, just completely distressed. Your first gut instinct might be to just jump in and stop the pain right away. But the protocol, it actually points us to a much more structured, safer approach. So where do we really start?
The protocol begins with a couple of foundational steps that really set the stage for everything that comes after. This isn't just about grabbing meds, it's about taking care of the whole patient, right from that first moment you meet them. And here's the thing you have to remember. Your first step is always to run your standard patient protocol, whether it's trauma or medical. You're looking at the big picture, A, B, C's, all that, while at the same time, you're starting to figure out, okay, why is this person in so much pain? And that leads us to the first major fork in the road on this flowchart. This one question is going to decide which way you go next. Is the cause of the pain super obvious, like a broken leg from a car crash, or is it something a little more mysterious? So if the answer is yes, you know exactly what's going on. You actually branch off and follow the specific protocol for that problem. But if the answer is no, or if that other protocol tells you to come back here, you stay on this path, and you move to the next crucial step, a formal pain assessment. Okay, so we've landed on needing to do a formal pain assessment. So how does that actually work? This is all about taking what the patient is feeling, which is subjective, and turning it into a hard number that we can use to make smart treatment decisions. So a pain assessment means using a standard scale, usually the numeric rating scale, or NRS. You just ask the patient, hey, on a scale of 0 to 10, where 10 is the worst pain you can possibly imagine, what's your number right now? And that number, it's not just a guess. It's basically the key that unlocks the door to the right treatment. And see, that score you get isn't just some random number. It puts the patient's pain into one of 3 distinct buckets. If they say 1 to 3, that's mild pain. A 4 to 6, that's moderate. And anything from 7 all the way up to 10 is considered severe pain. And each of these buckets has its own playbook. So, depending on which bucket that pain score falls into, you're now going to head down one of 3 very different pathways for treatment. This is really the heart of the protocol, where all that assessing we just did turns into real action. And you can see it laid out pretty clearly here. Each level of pain has its own primary treatment plan. Mild pain, we're focusing on calming the patient down and maybe giving some oral meds. Moderate pain, we step it up to a stronger injectable anti-inflammatory. And for severe pain, well, that's when we bring out the heavy hitters, including opioids. Let's break down each path. All right, path number 1, mild pain. Now, believe it or not, the first-line treatment here isn't a drug, it's just reassurance. Simply calming the patient down can work wonders. If you do need medication, the go-to is oral acetaminophen. The dose is standard for pretty much everyone, kids and adults, 15 milligrams per kilogram. Now, if we're dealing with moderate pain, we escalate to ketorolac. This is a powerful anti-inflammatory drug, which basically means it fights the swelling and irritation that's causing the hurt. The protocol gives the tech on scene a couple of options: a flat dose of 30 milligrams, given slowly through an IV or in the muscle, or a weight-based dose of 0.5 milligrams per kilogram. Okay, now we're in the severe pain zone, and our toolkit gets a lot bigger. The provider has 3 main options to choose from. You can use ketorolac again, you can give IV acetaminophen, or you can go to the most powerful option, morphine. Let's drill down on a few key dosages here because they're really important.
First up, if you're using ketorolac for severe pain, the protocol is crystal clear about one thing. The max single dose is still 30 milligrams. That's a hard and fast safety rule to prevent side effects, no matter how bad the pain is.
Next, for IV acetaminophen, especially when you're treating kids, the dose is strictly based on their weight, 15 milligrams per kilogram. And the protocol is also really specific about how you give it. It has to be a slow infusion over 15 minutes to make sure it's safe. And finally, we have morphine. With this one, there is absolutely zero room for error. For kids, the dose is tiny, just 0.05 milligrams per kilogram. When you're using a powerful opiate like this, getting that calculation exactly right is everything. It's crucial for the patient's safety. But listen, giving that first dose of medicine is only half the battle. What you do next is just as critical.
You have to get into this continuous cycle of checking on your patient over and over, all the way to the hospital.
So here's how that loop works. Every 5 minutes, you go back and ask for another pain score. What you're looking for is a drop of at least 2 points from where you started. If you're not seeing that 2-point drop, the protocol says you can give another dose of the medication as long as you stay within the maximum allowed limits.
And here it is, the whole shebang. You can really see how all those pieces we just talked about fit together. You start at the top with first contact, you hit that decision point, you do the pain assessment, you follow one of the 3 paths, and you keep looping that reassessment at the bottom. It's one smooth, logical process.
And let's never forget what this is all about. At the end of the day, every single thing we do, every step in this protocol, it's all pointing to one thing: getting the patient stable and safely to the hospital, where they can get the definitive care they need.
So that kind of brings us to a final question to chew on. When you're really out there, in the back of the ambulance, what's the toughest part of this whole thing? Is it trying to get an honest pain score from someone who's scared and confused? Or is it juggling the drug choices and the math when the pressure is on? Something to think about.